Okay, this is a removal of a nevus, a lesion from the lower leg of a 29-year-old lady. You can see here it is, I've put the white ring around it. Anything below the knee should always be looked at, particularly in ladies, because the amount of sun exposure is generally greater. So this, we've looked at it with a skin microscope. We're happy that it's safe to be removed. So we're going to remove it, but we're not going to cut it out. We're going to use a machine called a hyfrocator, also known as electroscalpel. It's a microwave wand, and as you'll see in a moment, it simply vaporizes the tissue that it touches, and it heals with minimal or no scarring, which is why we like to use it. So in a second I'm going to put the light onto that, and we'll start using the microwave wand, and you'll see the thing disappear before my eyes. And then we'll use a piece of rough gauze to scrape off the dead tissue, leaving a dry wound, a little plaster on. It will scab and heal over a few days. It's already had a bit of local anaesthetic put in because you can't use the machine without, but that's all done. So I'm going to go around the other side. Get some light on it. Okay, you all right up there?
Yeah.
Good. Let me know if you feel anything.
Okay.
So this is the hyfrocator wand, and as you can see, just touch it against the skin now, and you can see it's vaporising the tissue as I touch it. So I'm going to go around the border, first of all to mark it out, and then vaporise the top of it. Once that bit's done, with a rough surface gauze and quite a bit of pressure, you can see it starts to come off. And we're soon down to clearer tissue. Now that's not deep enough, so we'll do a bit more. Here we go. Okay. You feeling any of that?
No.
You comfy there?
Yeah.
Okay, you're just dozing off.
Yeah.
Right, so this, the burnt off tissue is called eschar. That's what these bits are that you can see coming off. And now what we've got is a clean, dry wound. Some little bits of dead tissue which will come away. And that's going to have a dressing on it in a moment. And my model here has asked me to point out that she's not had her legs waxed because of what?
Going on holiday.
Because she's going on holiday, so she's going to do them shortly, so just in case you were wondering. Right, so that's going to have a dressing on it where a small plaster will do. It will scab over, and the scab will come off after a few days, leaving pink, new healing skin is pink, so it'll leave a little pink mark, which will be new skin, and that will gradually colour up into normal skin over a period of time, just like a surgical scar would. When the anaesthetic wears off, these do not hurt. What they do is they itch. So one of the reasons putting the dressing on is to stop the patient from scratching it when they're in bed at night. But an itch is a good sign because an itch is healing, and it'll soon scab and calm down, and that's the end of that. I'll check on that in a couple of weeks, see if it's okay. This is the third one we've done today, isn't it?
It is.
And you've had enough now, haven't you?
Yeah.
Yeah. Okay. So that's how we remove warts, skin tags, things like this. Anything like that that's safe. We'll look at it first of all, make sure it's safe, and if it is, it can be removed painlessly and easily like that. So that's how the procedure is done. Right. There we go. Thank you very much.